thinking about managing these symptoms at home. From an infection preventionist and epidemiologist perspective, do you have any advice you can share with patients and their caretakers who have to deal with this on their own at home?
Absolutely. First, Steve, I'd say that every household in America with internet access should probably go ahead and save or bookmark the CDC's COVID-19 page. Information is constantly evolving, and I think this is the best way to have the latest guidance for the public at your fingertips as it's made available. And if anyone does not have access to the internet, I would recommend that they call their local health department to receive the most up-to-date recommendations as needed. But as you mentioned, Steve, many people with COVID-19 are self-resolving at home. I think it's also important to add to that many of these people, while they're infectious, could present very mild to no symptoms at all. So with that said, regardless if someone thinks they're sick or if someone thinks they're healthy, in order to help put an end to transmission, there are basic prevention steps that need to be followed by everyone in the community at all times. These things include, as you're hearing over and over again, staying at home unless movement is absolutely necessary. If by any chance you must leave the home or be around other people, you need to keep at least a 6-foot distance between yourself and others. I still like to go running for exercise in my neighborhood just as an outlet. And even when I do, I have to make sure if I see another runner or a mom with a stroller or a couple just taking a stroll, that either I step in the street or in the grass to keep a 6-foot distance away from anyone else in the community. A newer recommendation that we have is if you must be around others or in a public space, the CDC is recommending that you cover your mouth and nose with a cloth face cover. And this isn't necessarily to protect you from others, but it's to protect other people from you, just in case you're already infected with COVID-19 without even knowing it. Also, outside of that, just basic respiratory etiquette and hand hygiene etiquette. If you cough or sneeze, cover that up. Washing your hands constantly throughout the day with soap and water is definitely a surefire way to keep yourself protected. If for some reason soap and water are not available to you, you can use hand sanitizer, but you're going to want to make sure that at least 60% alcohol is included in that sanitizer. You're going to want to avoid, taking your hands and touching your eyes, touching your nose, touching your mouth throughout the day. And within your home, keep it clean and disinfected. We have a lot of commonly touched surfaces in our home, whether it's doorknobs, light switches, rails, tables, any type of commonly touched surface area, you're going to want to clean and disinfect that actually daily. And I know that's a lot, but this is definitely one of the most effective ways to keep your environment clean, keep yourself protected. Outside of that, everything I just said applies to all of us, you, myself, anyone else in the community. I will say, if you think that you may be sick, if you start to see symptoms and you suspect that you might be becoming ill, you're going to want to adhere to everything I just said, but there are some additional things that would apply to you. If you feel you're getting sick, definitely you have to stay at home. The only time you need to leave the house is to receive medical care. But even then, you're going to want to call your provider first before you leave your home for that medical care. So definitely call in advance, get those recommendations before leaving your home. You're going to want to wear a face cloth covering your mouth and nose, and that is what's going to help prevent the transmission to other people, as well as prevent contaminating your environment. And also, if you're in the home with other people, especially, isolate yourself in the home. What that means is you're going to have to find a way to separate yourself from anyone else that might be in the home. And this unfortunately includes isolating yourself from pets too, because while we don't think that they're going to get sick with COVID-19 per se, they can certainly help to transmit pathogens from one person to another or across your environments within the home. Most importantly, you don't want to share household items with anyone else that might be in the home. And if you can, try not to even share a bathroom with someone else in the home if sick. And last, my recommendation would be to anyone at home that is self-resolving and has symptoms. It's so important to monitor your symptoms closely and keep your provider up to date on any changes, most especially if you think something is worsening.
Great, thanks for that.
Absolutely. So I have one more question for you, Steve. I've got to ask. I mean, everyone is wondering, can you tell me a little more about the potential treatments that are in the docket for COVID-19 at this time?
Yeah, I think I can address it in a couple ways. There are basically two strategies that scientists and researchers are approaching COVID-19. One is to give you a treatment in terms of antiviral, and the other that we're focusing on is on immunity. On the antiviral front, if we can be drawing some conclusions or learnings from other viral infections, viral particles are relatively simple machinery, if you will, which is unfortunate because that limited number of target sites that we can attack. So if we can draw any conclusions from things such as influenza or mono, most of these are very difficult to treat in terms of a cure, if you will. So I think the likelihood of coming up with treatment really would be dependent upon ways of minimizing the symptoms so that we can help patients feel better and have less organ damage at the end of the day, rather than a complete cure or eradication of the virus, if you will. The other thing that oftentimes antiviral therapy can do is to shorten the duration of symptoms, so that we can make the patients not cough as much or reduce the amount of virus that are projected as they experience the symptoms, and hopefully reduce the viral shedding and reduce the transmission that's occurring in the community or the hospital. So I think that's kind of where we are seeing in terms of the treatment. In terms of immunity, now obviously a lot of people talk about the vaccine, which is what we call active immunity, and those are currently in human phase 1 trial where we're giving it to people to see whether they will develop antibodies or not. Unfortunately, with the development of vaccine does take some time to make sure they're safe and effective, as well as ramping up production, because they are unlike a pharmaceutical, like a drug or a pill, if you will. It takes a lot longer to ramp up the production, so we're probably at least a year away from a vaccine. So in the meantime, what we're doing is what we call passive immunity, where we're asking people who have been infected with COVID-19 and have recovered to donate their plasma so that we can extract those antibodies from their plasma and then transfer that antibody into someone who's currently battling the illness and acutely ill. So hopefully those antibodies will grab onto those viruses and destroy them, so that would help your body's immunity to attack that and help those patients who are really struggling in the hospitals and the ICUs. So that's kind of where we are in terms of treatment. I wish I had better news, but I think that's just kind of what we're dealing with.
Very helpful, very interesting.
Yeah, and thank you for sharing all the information that you had provided us, and it's great chatting and catching up with you.
Absolutely, always great to see your face, Steve.